Danielle, thank you. Well, parents, this is no secret. Our kids always have their hands on their smartphone, a tablet, a laptop, you name it, right? But it is also no secret that too much screen time is bad for them. A new study published in the journal JAMA Pediatrics shows that it can hurt the development of their language, their literacy, and their cognitive skills, which is all the more reason to get your kids outdoors. There's another new study that shows there are serious perks to playing outside. Teens who spent more time outdoors may be less likely to become nearsighted later in life. And joining us this morning is Dr. Ben Larson. He is the CEO of Advanced Eye Care of Central Florida. Always great to have you. Thanks for coming to see us, Doc. So this is something that you guys are seeing more of. Kids who are coming to you who are nearsighted, and many times or oftentimes it's because there's always this right in their face. Is that right?
That is true. So you don't want anyone to become more nearsighted. It can cause a lot of eye diseases, for example, retinal detachments, glaucoma, macular degeneration, even cataracts. And it's because when you're more nearsighted, your eye's more elongated, so it stretches that retinal tissue. That's basically what happens.
Now, in a lot of cases, nearsightedness or farsightedness is something that's genetic, right?
Correct.
But what you're seeing is that we're actually creating our own problems.
Yeah, there's environmental causes as well. So what we want to do is we want to address not just focusing light to the macula when we bend light as eye doctors, but we want to push those peripheral light rays inside the eye also. So that's what we're getting better at doing with different options we'll talk about. But
okay,
that's
so
how we're slowing it down.
Let's get into the options, because there are some different options. And one of the things that you guys try is, and it's actually good for kids and adults too, is something called orthok. Explain how this works.
Ortho-k, short for orthokeratology, basically is reshaping the cornea with the contact lens that you wear while you're sleeping. Okay. And it's very similar or akin to like your ring on your finger. It'll leave an imprint when you wear it overnight. You also see clear with them on, so that's also nice.
So is it something you just wear while you're sleeping, or can you wear them during the day, or what do you recommend?
You can wear it during the day, but there's no need, because when you wear them while sleeping, which is the only lens I'll allow a patient to sleep in, because it's very gas permeable and very small. But while sleeping at night, when you wake up and take them off, you see just as good as if you had the lenses on.
You sent in some pictures so that we can kind of see what happens when you're nearsighted. So we want to show that just to give folks at home an idea of. So myopic is another word for nearsightedness, right? Okay, that's sort of the technical term for it. So show us what we're seeing here.
So on the left there, you'll see the peripheral light rays. They're at the top and the bottom. They're going behind the retina. We're in the center, which is usually what we do as eye docs. We get that central light ray right to the macula, and that's where you see 20/20. But we're not addressing the peripheral light rays with traditional glasses or contacts. On the right, that image there is showing what ortho-k can do. With the magic of the reverse curve of an ortho-k lens, we can bring those peripheral light rays inside the retina.
So you're actually correcting the vision so that at some point you wouldn't have to wear them anymore?
You would still need to wear them to keep those light rays where they need to be, but only at nighttime.
Wow, which is really fascinating. So anybody that struggles with glasses or contacts during the day, it's really a great way to sort of correct the issue.
Exactly.
Okay, so as far as getting outdoors more, is this something you talk to parents about? Is that a way to technically cure it, or not really?
It's a way to slow it down or prevent it also, because we know that distance activities where your eye is at a relaxed state doesn't encourage myopization. It discourages it. So 1 to 2 hours a day is important, or the 20-20-20 rule I talk about all the time.
Which is what?
Which is every 20 minutes, take a 20-second break and look 20 feet away.
Gotcha. So if you sit at a computer screen all day, get up, force yourself to walk around for a little while.
Yeah.
Okay.
Especially the 30s and under, because those are the people at risk for becoming myopic. But after 35, 40, you're pretty much done.
All right. It is fascinating. It really is. Well, hopefully we can start turning this tide around. But I'm not sure we're going to stop this, Dr. Ben, because we're going to still see a lot more.
Exactly. I know. Myself
That's not going to go away. I know. We're all guilty of it. Great to have you. Dr. Ben Larson, thank you so much for Advanced Eye Care. All right, let's send it over to Danielle.
And you just